Snyder, and this is my husband, Ray. We are the proud parents of 4 of the most handsome, intelligent, athletic, talented boys in the world. Come on, you knew I was going to say that. When I tell people I have 4 sons, they say, God bless you. I say, he did. Like any family, we face many challenges. We get frustrated when they can't remember what 8 times 7 is, despite the fact that we've told them. Or staying up late to complete a science fair project that they had 3 months to do. Or just get off the bus and do your homework right away. They have trouble with girlfriends and schoolwork and not making the sports teams they want. But for 2 of these boys, these are minor in comparison. 2 of these boys aren't even allowed to try out for hockey, lacrosse, football, or wrestling. Despite the fact that Nicholas knows every statistic there is about the Flyers and aches to play hockey, he will never know what it's like to be on the ice and hear the fans scream, "Score!" Oh. Every mother has to tell their children no. It's hard to do so when you feel you are to blame. You see, hemophilia is transferred from mother to son. While the boys think it's funny that I'm a spontaneous mutant, hemophilia did not run in my family. I think it's horrible. My children's diagnosis was atypical. We didn't find out about their illness until they were 5 and 6 years old. Bleeding in my oldest was attributed to his red hair. And the bruises all over Andrew was because he was fearless like Bam Bam. When Nicholas was 18 months old, he had to have his tonsils and adenoids removed. It was an outpatient procedure. They did the normal blood work beforehand and everything looked fine. Except I found out later his PT level was a little bit off. After the surgery, I was so grateful to see Nicholas until about 3 hours had passed. At that point, Nicholas started bleeding from his ears, his nose, his throat, and his eyes. I was horrified. The surgeon came in and started shoving gauze pads into all of his orifices. They told me that if I felt better, they'd keep him overnight. So I left the hospital with my parents, went home to get a bag. And of course my cell phone went dead. As I walked into my house, the phone was ringing. They had to pull Nicholas back into surgery to recauterize all of his areas because they couldn't control the bleeding. The next day, the surgeon so carelessly told me that he just must have nicked Nicholas during the surgery and that's why he bled. I was so frightened as a new mom, I didn't say a word. 4 years later, Nicholas's tonsils grew back. There's a 1 in a million chance that happens. So they had to be removed. I said to the doctor, this didn't go so good the last time, I'm not comfortable with this. So they did the testing, they did factor testing and found that he was indeed factor VIII deficient. The second time, Nicholas was treated with factor both before and after surgery. But this time I didn't just have 2 kids. I had a 6-year-old, a 5-year-old, a 2-year-old, and a newborn. What was I thinking? His recovery went very well. All in all, Nicholas had 9 surgeries before the age of 8. They're scary in and of themselves, but when you add hemophilia, it can be terrifying. The boys were both mild hemophilia and only needed treatment for major trauma. For years we had to educate ourselves and sometimes the doctors treating them. Andrew, at the age of 7, sprained his ankle playing baseball. I told the local ER doctor that he had hemophilia. The doctor said, no, there's no bleed. It didn't show up on the ultrasound. I said, okay. 3 days later, the pain was so intense, we had to go down to Children's Hospital. Andrew ended up in a cast and on crutches, followed by 6 months of physical therapy. All because the doctor and I didn't treat the bleed immediately. These times were very tough for us, but we would go to chapter functions and talk with other families. We would hear stories of moms that had to give their little babies needles 3 times a week. It broke my heart. I prayed for them. On December 19th, our lives changed forever, 2011. Andrew was diagnosed with an inhibitor. What, you might ask, is that? It's evil with a capital E. It meant that Andrew's own body was attacking the very thing it needed, factor VIII. But again, the only inkling I had that this was a bad thing, that the doctor gave me her personal cell phone number. I thought we'd still be fine. Not for long. On Christmas Eve, Andrew was playing Wii bowling, as he's done a million times. He didn't complain on Christmas Day until a little bit later in the evening. He said he just had some trouble moving his arm. We didn't think anything of it. I couldn't see the swelling. But the next day I did take him down to CHOP. The nurse told me how to see that it was a bleed. Gosh, when she pointed it out, it was so obvious. They kept Andrew overnight and treated him with factor VII. His body needed factor VIII, but somehow this factor VII helped. And so it began. 16 times, almost every week, Andrew was admitted to Children's Hospital for mostly spontaneous, meaning no trauma, bleeding. It's pretty scary when the ER doctor turns to you and says, "Okay, Mom, what's the treatment plan?" Well, Andrew and I learned what it was very quickly. A needle every 2 hours to stop the internal bleeding. Andrew made the varsity A team as a 7